COVID-19 cases are reaching record highs in parts of the UK as the highly transmissible Omicron variant continues to spread across the country. Two-thirds of local authorities in London now have their highest rates since mass testing began in summer 2020, while cases are also startlingly high in southeast England and eastern England. Sign up to our NationalWorld Today newsletter. The newsletter cut through the noise with infection rates reportedly doubling every couple of days. Here's what you need to know about the symptoms of Omicron and how long they last. What are the symptoms of Omicron? Infection with the Omicron variant appears to cause mild illness for most people, based on findings so far, but it is still possible that symptoms could be more severe. Evidence so far also indicates that this variant may cause less damage to the lungs than both the Delta variant and the original COVID-19 strain. Dr. Angelique Coetzee, a private practitioner and chair of South African Medical Association who first identified the variant, said that while patients have had extremely mild symptoms, more time is needed to fully understand the effect it could have on vulnerable people. The following symptoms have all been linked to Omicron infection so far: fatigue, body aches and pains, headache, scratchy throat, night sweats, dry cough, fever, runny nose, sneezing, nausea. Taking a paracetamol and getting plenty of rest will help to ease the effects of infection, but if you are worried about how long do symptoms usually last? As with other COVID-19 strains, symptoms of Omicron should typically clear within a few days. Dr. Coetzee told the Daily Mail, the symptoms presenting in those with Omicron are very mild compared with those we see with the far more dangerous Delta variant. Patients typically present with muscle pain, body aches, a headache and a bit of fatigue. And their symptoms don't seem to get in. It takes between 5 and 6 days on average for someone who is infected with COVID-19 to experience any symptoms, according to the World Health Organization, WHO. However, symptoms can start to appear from 1 to 14 days. If you get a positive test result, it likely means that you had COVID-19 when the test was taken. The time taken to test negative after contracting coronavirus will depend on the severity of the case. Gavi, the Vaccine Alliance, says it is possible to test positive COVID-19 for weeks, but people are likely not to be contagious for very long, even after a positive result.